Okay, let's go to the topic ocular movements. The ocular movements are broadly classified into unilateral and binocular. In unilateral, adduction, abduction, elevation, depression, intorsion, and extorsion. That is adduction, abduction, elevation, depression, intorsion, extorsion. Binocular movements. Unilateral is in the same eye, and the binocular is in the both eyes. And the versions, they are conjugate movements: dextroversion, levoversion, supraversion, infraversion, dextro elevation, dextro depression, levo elevation, levo depression, dextro cycloversion, levo cycloversion. Dextroversion is looking at the right side, and levoversion is looking at the left side. Supraversion is looking up. Infraversion is looking down. Dextro elevation is looking right side up, and dextro depression is looking right side down, and levo elevation is looking left side up, and levo depression is looking left side down. And dextrocycloversion, dextrocycloversion is a rotational movement around the anteroposterior axis, in which the superior pole of cornea of both eyes tilts towards the right. The levocycloversion is the reverse of that. And disconjugate movements, divergences, convergence and divergence. Convergence is simultaneous inward movement of both eyes. Um, it is done by contraction of medial rectus of both the eyes. That is like this. And divergence, simultaneous outward movement of both the eyes. Contraction of lateral recti. Mm, then the concept synergist and antagonist. Muscles having similar primary action in the same eye. Example, superior rectus and inferior oblique are the synergistic elevators of the both eye, as we saw. And antagonist, muscles having opposite actions in the same eye. Example, medial rectus, lateral rectus, inferior rectus, superior oblique and inferior oblique. Antagonists to each other in the same eye. Contralateral synergists and antagonists. Contralateral synergists, pair of muscles, one from each eye, which contract simultaneously during version movements. For example, it is the York muscles. And contralateral antagonists, pair of muscles, having opposite action, one from each eye. Okay, here we come to the gaze. Gaze is totally nine. There are totally 9 gazes. Primary gaze 1, secondary gaze is 4, tertiary gaze is 4, and excluding this, there are 6 cardinal gazes. That is 1, 2, 3, 4, 5, and 6. Okay, 9 gazes. This is dextro elevation. That is looking right side, right side up. As we know that superior rectus and inferior oblique are synergists, and inferior rectus and the superior oblique are synergists. In the right eye, it is right superior rectus, and in the left eye, it is left inferior oblique. Whereas in levo elevation, in right eye, it is right inferior oblique. In left eye, it is left superior rectus, and in up gaze, that is looking upwards, in both the eyes, superior rectus acts, and dextroversion is looking right side, that is right lateral rectus and left medial rectus. In levoversion looking left side. In right eye, it is right medial rectus. In left eye, it is left lateral rectus. Dextro depression is looking right side downwards. In right eye, it is right inferior rectus. In left eye, it is left superior oblique. Levo depression, looking left side down. In right eye, it is right superior oblique, and in left eye, it is left inferior rectus. Coming to down gaze, that is looking down. In both the eyes, it is inferior rectus, and this is the primary position of the eye fixed at a point. And these are the laws governing the ocular movements. Hering's law of equal innervation, that is, equal and simultaneous innervation flows from brain to a pair of muscles which contract simultaneously. That is, we saw those York muscles in different binocular movements. Then Sherrington's law of reciprocal innervation is ipsilateral antagonist for uniocular movement, that is, for duction movements.